Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice start to your week. Looking forward to your Tuesday today. We'll help you make it a healthy one. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, June 29th, 2021. Going to look at 6 areas of health and wellness. Somewhere around this video you can read through all 6 areas, and if you have any questions or you want a copy of those, a hard copy version, you can DM us on social, give us a call here at the clinic, or send us an email. We'd be happy to help you out as always. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, the purpose of us sharing some good health information every day is just to get you thinking about health and wellness in general, and then you can hone in hopefully and stimulate some thinking about those decisions, actions, steps you want to take today to improve and or support those things that you want to see get better and or maintain for as long as possible in your life. And plugging into some good health information for a very short period, but every day as much as possible throughout the week, will help you on that journey. So there are a couple of areas in the daily health update today that are pretty serious, I would say, and not always fun to talk about. So I'm going to let you read through them. In the journal Medicine, for example, June 2021, they talked about how acne may be a risk factor for suicide. There's about a 50% increased risk for suicide when they looked at a group of about 2.2 million people with acne. And they recommend that people who are getting treatment for that, especially medically, be screened for suicidal thoughts. So good information to know. It's interesting how our body works, how our mind works, and some of the things that we encounter in our lives as we navigate each day to the best of our ability. But there are challenges, and sometimes they can be big challenges. So it's good to know that there's these correlations that might exist between these different conditions so that we can keep an eye out for ourselves and especially those people around us, and especially those dear ones that we love, right? So good to know and good to make note of. The Diabetes Care Report from May 2021 looked at high glycemic index diet being linked to weight gain. The glycemic index is a value used to measure how much of food increases the blood sugar levels. A long-term study that included over 2,000 overweight or obese adults found that those who maintained a diet featuring high glycemic index foods such as white bread, potatoes, and rice gained about 1.1 more pounds per year than participants who largely avoided such foods. There are strategies such as low glycemic index or low glycemic load eating. That information exists on the internet. However, when it comes to nutrition and it comes to you, there's probably no cookie cutter approach. There are some general recommendations that are probably pretty solid across the board. However, it would not hurt, depending on your health goals and what you're looking to do, to contact a qualified healthcare provider to support you in making decisions around what nutritional approach would work best for you. All right. So always a good idea to get help in these key areas, sleep, nutrition, and activity or fitness as necessary. It's a case-by-case basis, but we encourage you to do that, of course. JBMR Plus reports in May 2021 that strength and impact training reduces skeletal aging. Over a 10-year time frame, researchers observed that middle-aged and older sprint athletes who reduced their training experienced a decline in bone properties in the lower leg, while those who maintained their training either maintained or actually improved their bone quality over time. The findings suggest that remaining active later in life is important for healthy bones. So we all know about calcium, and we may know about vitamin D and vitamin K, how they help in that process with calcium. Vitamin D helping to make sure it gets incorporated into the bone, vitamin K making sure that we pull it out of the bloodstream. So those three work well together. However, there's also something called Wolff's Law, and Wolff's Law tells us that without impact or stress on the bone is less likely to utilize or become more dense with that calcium. So activity, weight-bearing exercise, and resistance training is important for our bones to get a little bit of positive stress so that it does get encouraged to calcify and to become more dense. And that bone density is what we want to try and get a peak into our late 20s and then try to maintain for the rest of our lives. So strength and impact training is an important part of that process. A couple of other areas that you may want to talk to a qualified healthcare provider about, but is interesting to think about and know that it exists, so we will share it with you. The Journal of Addictive Medicine, June 2021, looks at gambling problems and how they're linked to disability, so you may want to read through that in the hard copy. And finally, the Journal of Clinical Gastroenterology looks at people who may need to take an antibiotic, but about 10% of those people who take an antibiotic for a reason will have diarrhea. And taking a probiotic can decrease the risk of that antibiotic-associated diarrhea by up to 36%. However, again, with these kinds of specific research findings, you want to be sure you talk to a healthcare provider before modifying or deciding to take on these strategies, as it may impact or relate to your current health status and any problems you're trying to treat directly and indirectly. So make sure you seek some guidance on those ones. Finally, the journal Physiotherapy, March 2021, looked at chiropractic adjustments and how they're effective for chronic low back pain. An analysis of data from 20 randomized controlled trials concluded that spinal manipulative therapy, the primary form of treatment used by doctors of chiropractic, is effective for reducing pain and improving function in patients with chronic low back pain. Something that, of course, we probably associate chiropractic and other manual therapies with, but it's good to know that the research continues to support that there is hope and a potential benefit for someone with chronic low back pain. Now, does it always help everybody? Probably to some degree. When a paramedical provider, such as a chiropractor, massage therapist, acupuncturist, osteopath, anyone in those paramedical professions gets their hands on somebody, if you will, there's probably some related benefit. However, how much and to what degree someone improves, again, is a case-by-case basis. But the research does show when those treatments are done in conjunction with self-care, such as some kind of rehabilitative exercises, and or you mix and match some of those therapies, it just increases the likelihood of a positive outcome. So it's all good, but again, probably has to be customized, individualized, and personalized to the person. So get out and seek the care, get some good advice, and head yourself in that good, positive health direction to support those great experiences you're looking to have every day. And today, hopefully you have had or will have some of those, and we encourage you to enjoy as much as you can. We'll catch you tomorrow, Wednesday, middle of the week, with your next daily health update. Look forward to chatting with you then. Take care, be well.